Hi there, I'm Dr. Bin Hoang from Radiant Smiles Dental Care. My practice is in San Juan Capistrano, California. I specialize in saving teeth. I give hope to hopeless teeth. I graduated from the University of Maryland Dental School in 2003. I am originally from California, so when I went back home to California, my very first job in 2003, over 20 years ago, was to work for Dr. Robert Gregg. Dr. Robert Gregg invented the LANAP Protocol and the Perioles MVP7 dental laser. The Perioles MVP laser and the LANAP Protocol is designed to reverse gum disease and save hopeless teeth. So I was excited and motivated very quickly and early in my career to save teeth. And that's why I adopted the Perioles MVP7 and the LANAP protocol in my practice very early in my career. Now I have become a LANAP instructor at the Institute of Advanced Laser Dentistry to teach other dentists and teach other gum specialists how to use the LANAP protocol and the Perioles MVP7 to treat gum disease, to reverse gum disease, and try to give hope to hopeless teeth. I'm making this video because most of the patients that come to my office have some sort of gum disease. Gum disease is very prevalent. You might not even know you have gum disease. Statistics tell us that over 60% of American adults have some sort of gum disease. Now, a ridiculously low percentage of those patients actually get gum treatment. Why is that? It's usually because of fear. Patients are scared of getting traditional treatments for gum disease. How do you even know you have gum disease? Most of my patients come to me because they've been told they had gum disease from another dentist. But what if you haven't been to the dentist in a while? Do you have bleeding gums? Do your teeth bleed when you brush or floss? Are your teeth mobile? Do they move around when you eat and chew? Do you have bad breath? That's one of the signs. What happens if you have gum disease and you don't do anything about it? What are the consequences of having gum disease and letting it go too far? What is gum disease? Gum disease is when bacteria that is naturally in your own mouth lives off the food that you eat. So imagine my sleeve here is your gum tissue and my arm is your tooth. There is a space in between your gum and your tooth. Now that space gets deeper and deeper and deeper over time because bacteria, the bugs, love to hide underneath those spaces. This bacteria lives off the food that you eat. They're like little microscopic animals. They live off the food that you eat and they create like this acidic environment. That acidity eats through not only your teeth that can cause cavities, but it can also eat through the tissue. Now over time, that tissue in the inside of your pocket of your gum and your teeth gets inflamed and it gets diseased. And you lose that tissue and it gets to a point where your body gets overwhelmed and your body just can't mop up that infection anymore. What's holding your teeth in your mouth is actually your jawbone. Your jawbone holds the roots of your teeth in your mouth and your gums overlay that. Now, if we allow this disease to progress too far, what can happen is that you will lose gum tissue, you lose bone, and eventually that stability, that foundation that holds your teeth in your mouth gets disrupted and is jeopardized. So I compare the jawbone and your gums to a foundation of a house, for example. So when you build a house, you want a strong foundation to keep the house up, right? And so when you have gum disease, the foundation is the weakest link. If our goal is to keep our teeth in our mouth for the rest of our lives, we need a strong foundation, we need strong bone, we need strong gums. And that's why treating gum disease is so important. Now let's discuss the possible treatment options for gum disease. Traditional treatment options involves either a deep cleaning, which is technically called scaling and root planing. You've probably heard of that if you've been to the dentist. Now, the second option is gum surgery. So the goal of gum surgery is if you have a deep space in between your teeth, you want that space to be more shallow. But the surgeon can't distinguish between healthy tissue and unhealthy tissue within this space. So what the surgeon does is cut the tissue, all of the tissue away, so that you'd have a shallower pocket. Now, this is resective surgery. This is amputation. We can't get this tissue back after you remove it. Now, here's the good news. There's a laser way to treat gum disease with the LANAP protocol and the Periolase MVP7 laser. LANAP stands for Laser Assisted New Attachment Procedure. It's the first and only FDA-approved periodontal protocol with research and science to back it up. Now, LANAP is like LASIK. It's a minimally invasive, definitive protocol, is less invasive, patient-friendly, and highly predictable compared to traditional surgery. Now, here's the good news. There's a laser way to treat your gums without the cutting, without the stitches, without the pain, and without the fear. And this involves the LANAP protocol. LANAP stands for Laser Assisted New Attachment Procedure. It's minimally invasive, patient-friendly, highly predictable, and it works. It's FDA approved. There's science behind it. It's taught to perio residents, gum specialists in universities. It's taught to gum specialists in the U.S. military, the U.S. Navy, the U.S. Army, and the Air Force adopts this protocol and teaches it to the residents. I am a LANAP instructor at the Institute of Advanced Laser Dentistry and the Millennium Dental Technologies, and I teach other doctors the LANAP protocol. Now let's talk about LANAP. Why would you even want to use a laser compared to traditional surgery? Traditional surgery works, and it's been around for a long time. Why would you even want to use a laser to treat your gum disease? Well, you can compare it to LASIK. Before LASIK, they used to replace corneas with a scalpel. But now, with the advent of LASIK, who would ever choose the traditional methods of eye surgery with a scalpel when you have LASIK? So this is the same comparison of why would you even choose traditional surgery, resective surgery, amputation surgery over LANAP therapy. Now let's talk about the LANAP protocol. Why would you even want to use the laser to treat your gum disease? When you have gum disease, the intention is to, again, reduce the space in between your gums and your teeth so that bacteria doesn't have a chance to crawl underneath there, eat the food that you eat. It's more cleansable, right? So you want that space to be as shallow as possible. Now, you can make it shallow by removing the gum tissue, by cutting it with a scalpel and a blade. That's traditional surgery, right? Or you can do it by regeneration, which is LANAP. Which one would you choose? So the Periolase MVP7 laser can distinguish between healthy tissue and unhealthy tissue. So the Periolase MVP7 laser can selectively distinguish between healthy tissue and unhealthy tissue. It leaves the healthy tissue alone, which is usually the connective tissue. The Periolase MVP7 can distinguish between healthy tissue and unhealthy tissue. It leaves the healthy tissue alone, which is usually the connective tissue, and it ablates, it just vaporizes away the diseased epithelium, which is the skin underneath your pocket here. It vaporizes it away. So with the LANAP protocol, we do remove diseased tissue away. However, the tissue that is removed is replaced by regeneration. So that tissue is not gone forever like the amputation methods of traditional surgery. That tissue that is removed is replaced by regeneration of your own healthy tissue. Those stem cells or mesenchymal cells can actually differentiate and become new skin, new bone, new connective tissue, new ligaments that was lost throughout the disease process. We are able to regenerate all of that back, and it's gold standard. Now, the last step of the LANAP protocol is to seal the gums. The mouth is a dirty and unstable place. So the next step of the LANAP protocol is to activate the stem cells that are in your own blood to become new tissue, new ligaments, new connective tissue, and new bone. We're not using any cadaver bone. We're not using any exogenous materials that can be expensive. We're using your own blood to regenerate what the disease has taken away from you. The last step of the LANAP protocol is we adjust your bite. Everyone who has gum disease has a very unstable bite. So to make everything heal properly, we make everything hit evenly so that you heal properly. That's part of the LANAP protocol. And then we just sit back and watch it heal. Typically, LANAP is either done in 1 or 2 appointments. If it's done in 2 appointments, you do one half the mouth, and a week later, you will do the other half. And a week after that, we see you for a post-op. In my office, we do it all in 1 appointment. We do all 4 quadrants, full mouth, with oral conscious sedation. So if you have fear of going to the dentist, twilight sleep dentistry is awesome. You're gonna love the experience. You just take a pill the night before, and then a pill the morning of the appointment. You're gonna have someone drive you here. We're just gonna put some blankets on you. All your vitals are monitored. Everything is safe. It's oral conscious sedation, so you just take a pill while you're here again, and a little bit of laughing gas. So it's conscious sedation. You're gonna be awake, but everything is done in 1 appointment. The very next day, you're gonna wake up and you're gonna be like, that was not bad, and that was pretty easy. And usually that's the experience with LANAP and with sedation. With sedation, you'll remember maybe 5 minutes of the appointment. A week later, after LANAP, we see you for a post-op appointment. It should be a very easy appointment. We check your bite, we adjust it if needed, and we make sure you're comfortable. Eventually, we make you a bite guard, a night guard, and after that, it's just maintenance. Every 3 months, indefinitely, we're gonna see you. You're gonna be healthy. After the procedure, we just watch you heal. The beauty of LANAP is that it's a gift that keeps on giving. It keeps on regenerating you as you do your perio maintenance recalls every 3 months, and we just watch it heal. We expect great results. We expect you to be comfortable, and we expect you to be happy.